our emphasis this morning is on homeless. Who are these people? But not just who are these people, what are we doing here? And some things are being done. This isn't just, let them freeze. Some of you remember a couple of years ago we had Jean Nickel, who's done studies across the whole state on the faces of poverty in North Carolina. Not just data, but stories of people. And I look forward to Dennis and Kyna sharing with us what is being done. Dennis is the homeless advocate through the police department. He's not wearing a uniform. That isn't a badge. He's not out to arrest people. But he is here to tell us what his outreach work is. And this is dovetailed together with Rowan Helping Ministries Executive Director, Kyna Grubb, who's with us today, because it's really a whole thing that is being done here. So I will take what's left over from my breakfast and take it away, Dennis.
How y'all doing? I hate standing behind a podium, so I'm gonna be isolated right now. So since the camera's right there, so to introduce myself, my name is Dennis Rivers. I work at I used to work at Bronco Barrels Community College. I currently work for the city of Salisbury through the city police department as a civilian. So I'm not an officer, but I am a civilian. Can you hear me now? Test. Okay. Can you hear me now? Yes. Okay. So I thought I had a deep voice, everybody can hear me, but I'm a civilian at the police department. I've been with employed since May 17th last year. So to give you an idea with the role for my as a civilian is I'm a victims advocate, but also in a special projects program. Special projects is working with the homeless community, and primarily through the city took initiative, whereas they want to make sure to just find someone to be able to go to the different campsites and talk to the homeless, not only those who can't get into the shelter, but those who are out at camp, to try to give them the resources either to get into the shelter or the resources to get them stable back on their feet. And so therefore, partnering with Rowan Helping Ministries, what we do is we go out every week and we do outreach. And during that outreach, we really touch base with a lot of the homeless that are actually in the streets, where we try to get them either into the shelters or also just get them connected to the shelter in general. A lot of them may not be able to be eligible to get into the shelter as far as living there, but also be able to utilize some of the resources that the shelter has with the different programs that, of course, Ms. Kyna is going to share also. So to kind of give you an idea what my program is, we literally go onto the communities, talking to the different various locations from the campsites you might not even know or even recognize. The campsites like behind Tinseltown. There's campsites behind Walmart. There's campsites behind the old Pizza Hut on East End Street. There's several campsites that you might not even recognize, might not be aware of. So you ask yourself, what is the city's doing? One thing to say the city has been doing, for one, took initiative with this position right here, is a grant-based position for 3 years. And the initiative is basically to get someone to not only working for the city, whereas the city can now identify some of the different landmarks or the different areas in the community that we can try to help those who are in need. So within the partnership that we formed over this past year, with Rowan Helping Ministries leading, we have several different on board, from Novant to Family Care Clinic to DSS to Health Department to the school system. And the reason why we say the school system, because you might wondering why is the school system involved? Some of you may not realize, I believe this year, Ms. Tamika Brown, who's the liaison for the school system, she's identified 97 students in Rowan County Salisbury school system that's homeless. That doesn't mean that they're all living on the streets, but it does mean that they are displaced and either living at someone's relative house, like sleeping on the couch, or maybe sleeping in their backyard in a tent, or maybe just having their car parked in front of their house. So technically they still classified as displaced and as homeless as well. So with those type of partnerships right there, we can be able to either get them placed or even placed into emergency housing. So this is where my grant comes in. My grant been fortunate to be able to get some of the homeless off the streets where we couldn't get them housing within that day or within 72 hours or something like that. So therefore, those we identified, especially the families, we got them off the streets immediately within for at least 24 to 48 hours, or 72 hours rather. That way we can work through Rowan Helping Ministries, or work through the battered women's shelter, or work with those who have been identified as trapped in human trafficking as well. That way we can get them at least some type of emergency housing off the street temporarily. By doing so, we also making sure we're setting up some type of plans set up afterwards. That way, we're not just putting them into a hotel, putting them in a hotel just for that moment. Is basically a care plan being set up with them as well. That way, they can move forward as far as getting reacclimated into the community, especially more so safe haven. So this grant right here has like literally imploded as far as helping in so many different ways. And so many people ask, there's still a whole lot that's going on in need in the city. Yes, it is. The reason why I say it is because the city of Salisbury nor Rowan Health Ministries is going to be able to do it all. It's going to literally take a community effort to make sure we try to find ways to help all those who are underrepresented, some of those who might not even want to come to the shelter because of either their own mental health issues or substance use issues that they're dealing with that may hinder them from being able to identify some of the needs that they actually might help them get off the streets. So therefore we have to identify to try to help them. One thing we did also was we started getting state IDs. We linked up with DMV where they can get an official state ID for free. That state ID then also will help them start getting other things like their social security cards or the birth certificates. So we realize a lot of those that's on the streets don't have those documents to even not only get into the shelter, but actually start getting other resources that's needed, like applying for services at DSS or through the county and different things like that, or even applying for housing authorities. So without having those documents, it's starting the little processes of things to help them get, like I said, reacclimated into the community. One of the biggest things I'm a pet peeve of is health initiative. Some things try to get them to do is at least just get a checkup or at least just get a dental. So we have so many different resources available, whereas you have like One Love services, they'll offer mental health and treatment for free. Daymark offers services for free. We have the community care clinic to offer services for free. And then you also have Rowan Health Ministries sitting right there where they can just come there, where we have different programs that are offered them where they don't have to go everywhere. Everything is literally like a one-stop shop for them also. So as a matter of just sitting and actually know what the city is doing, I can truly say through my eyes and my lenses, I'm not a professional at all in this. I just going off of what my experiences are. The city has done a lot. Is there a lot more to do? Yes, there is. There's a lot of homeless in this community, but at the same time, it is going to take a community effort. And the reason why I say that is because some people think giving a community effort is just like giving someone a couple dollars when you see them walking down the street, or giving them a couple dollars when they're standing at Walmart. I hate to be ugly. That's almost like the worst thing you can do. Yeah. I'm not saying I'm cold-hearted at all. If anybody know me, everybody know I got a big heart. But at the same time, you're also hindering them and enabling them to live the same lifestyle we're trying to get them out of. So therefore, my philosophy is take it to a resource that's going to be able to help them even more so. So this is why the driving force, we try to redirect them back to Rowan Health Ministries or redirect them to other agencies. So I know we've been thinking we're doing some justice, giving our family members, a couple dollars when we see somebody with kids and stuff. So therefore, the best thing to do is almost just like redirect them. If somebody say they're hungry, I'll tell them to follow me to the shelter, or I'll buy them something to eat instead of me just giving them the money, whereas you don't know what the funds is going to be used for. Because again, we are dealing with those who are suffering from mental health as well as substance use. So again, trying to avoid them crashing on their daily activities. Therefore, we got to find a way to actually remove them from that type of lifestyle. And my philosophy is not just enabling them, giving them cash and stuff like that. Yeah. So again, this position really, I think, Rowan Salisbury, we probably the only one in the state that has the homeless liaison position. Yeah. So when I got hired, my thought process was, I like the network. I'm going to find somebody else in North Carolina that has the same title position as me. I'm still looking, which is a blessing, but at the same time, it was hard trying to figure out, okay, what is my role? What is my, my job duties and everything? So it's almost like hard to tell yourself or make up a job description for you, even though there was a generic job description, but it's also kind of hard to go out there and make a plan of action, who to partner with, who to talk to, who to next. So what I did was I went out and literally introduced myself almost to every agency throughout Rowan County. That was the first thing my initiative was. And luckily I had resources with Rowan Health Ministries where they introduced me to several people. Then other people, I just went out there and just introduced myself, saying, the downtown Salisbury, there was the biggest complaint, a lot of homeless people in that area, which is good. So again, I'm not one going to say I'm strictly for just making sure the homeless are being served. I'm also making sure that the businesses thrive as well, because one thing we don't want to do is have the businesses just like pushing them away. And now all they're doing is going to another location. So all you're doing, when you're moving from one spot, you're moving to basically picking up, sleeping in another area. Now it's going to cause an effect to that business. So what I did was basically introduce myself to a lot of the businesses downtown, try to tell them about the initiative, what we're trying to do, but also a way how they can help. So what we did was partner with, again, Rowan Help Ministries. We created these cards. And all they are just resource cards. It's just saying it has my contact information, direct contact information, then it has Rowan Help Ministries contact information, who is their outreach person, which is Miss Diane Bruce. And so what we did was, instead of you going talking to someone that's homeless and feeling uncomfortable, let us be that initiative where we'll just give them, you give them a card and it has our contact information, and you say, hey, talk to Dennis Rivers or talk to someone at the shelter, and they'll be able to help you. And the reason why we started that philosophy was because some of the homeless do get volatile. It's like some of us don't like no for an answer. So you got to understand at the same time, even though they're sleeping on your property, that's still their belongings. That's on your property. So when you try to like kick their belongings over, that's like waking up in the middle of the night and somebody just ransacks your house. That's the same philosophy. So even though it's not their property, but at the same time we have to be respectful. And so what we do is we tell all our business owners, if you don't feel comfortable talking with them, let us be that bridge. Let us be that connection to talk with them. And that way it be an icebreaker for us, that way we can also have a calm sit down atmosphere, talk about what their needs are, meeting them where they are for one. Because one thing we realize, most of them, the biggest transportation they have is either their feet or bikes. And if they have a bike, they're lucky to have one. So what we try to do is like just meet them where we are. That's why we go out to these different sites and just talk to them. We sit down with them for a couple of hours, couple of minutes. Some of them we sit down with, get back to the shelter. Some of them we sit down with, trying to get them an ID, different things like that. So it's a big plus. Then also at the same time, what we've been able to do was actually help them get reconnected with their families. So a lot of them may not want to just stay in the streets. They will say, okay, I have a family member that's going to help me. So partnering again with the shelter, we've been able to get bus tickets for several people transferring from here to Washington State, to Myrtle Beach, to West Virginia, to various areas. And what we do is we don't just ship them off either. One thing we do is we really investigate with my resources. We'll find out if they're on probation or parole, find out if they have pending charges in Rowan County or North Carolina, because we don't want somebody absconding at our pet expense. We also contact that family member. We'll find out what their address is and see if they actually true that they want to allow that person to come stay with them. Okay, then we'll give them a bus ticket, give them a little bit of food while they transport to that area, and we also touch down to make sure to see if they arrive as well. So it's so many different components, trying to find ways to help the homeless in many different ways, and there's still a lot to be done. But at the same time, this just kind of like giving an icebreaker of what you say, what is the city doing, because you see an abundance or influx of homeless coming in the community. The reason why yesterday, some of the conversations they say, either they got dropped off by the local authorities from another county, either they found out there's a shelter here, or they found out there's the VA hospital or a regular hospital. And then also they know there's a lot of drugs they can easily get access to here in Rowan County, to keep it real. So there's a lot of resources, even on the negative and the positive side, where a lot of them came here. You see a lot of them coming up and down 85. So you see them coming from Lexington, as far as from Statesville, coming up from Kannapolis. So you see a lot of coming here because they're thinking because there's a lot of resources there. To be a small town in a small city, Salisbury has a lot of resources on the positive side, but also on the negative side as well. And drugs is one of those things. So you ask yourself, what is there to be done? A lot of things basically is part of to be done is literally just identifying those areas and kind of like utilizing my program as well as the drug enforcement task program. Because one thing what they've been doing on the police department drug enforcement task force is if I identify an area that's a homeless community, they're not coming in there to arrest them. First thing I want to do is utilize me to help them find a way to get them off the street, get them assistance and things like that. So it's like giving them an option. But at the same time, we find out there's a whole lot of homeless who are actually the ones who are selling the drugs. So that's where I come into play at, and making sure I'm trying to identify who those are, but also trying to make sure we find services to help those who want to get help into the mental health or the substance abuse treatment more than anything. So in a nutshell, that's my role here with the City of Salisbury Police Department. Again, through Rowan Help Ministries, we formed a resource team that we meet once a month, and our resource team is probably 20 agencies or plus strong. And when I say different agencies, so I named off a few of them, but you have the fire department, you have also different city agencies, you have different nonprofit agencies, you have different people in the community in general. So we have a lot of stakeholders who are very interested in making sure not only to just clean up the city, but also make sure our homeless are having a voice and being represented to find resources for. So what I'm gonna do is I have a few cards, and this is our resource card. Again, a combination of the police department and Rowan Health Ministries. It has our contact information. And if anybody actually just come across homeless again, if you keep this on you, just best thing to do is just give them a copy of it and say, hey, have you met Dennis Rivers? I'm pretty sure majority of them have, and say, I know who you're talking about, or I know you're talking about Miss Diane Bruce, because we are all over Salisbury, in different parts of Rowan County. We don't really stretch out in the county part, because again, I am a city employee, because we have requests from as far as Granite, Faith, Rowan County side of Kannapolis, asking us to come down there, but because I'm a city employee, I only do go down for certain serious situations that they allow me to just travel that far. All right? No. Yes, ma'am.
Dennis, you and I have talked a couple of times on the phone. I'm Whitney Beckman.
Yes, ma'am.
And I called you about the young woman who apparently has fallen through the cracks completely. So I have a couple of questions. One is, she and her husband were arrested. That's how she got to Salisbury in China Road. So, and you know, to cut to the chase, this was not a case of drugs. This was a case of homelessness, and she was pregnant and out in the street in my alley. I tried to help her. I had a long conversation with Rowan Health Ministries and with Kyna Party's group, and nobody could get her to convince her to go to Rowan Health Ministries, because they required that she have a COVID test.
Mm-hmm.
And being pregnant, she was frightened that they would make her have the shot. Since then, she has lost both of her children to the system, and you reported to me that you could find a record of her through the police department. So my questions are, what is the police department approach when someone calls and says, somebody is in my alley and they're ranting and blah, 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 blah? What's the police department approach? And secondly, what happens to the people who cannot give you, who can't reach out to the two agencies on the card because they don't know about them, whatever? But I mean, is this going to be a case of what happens to her?
Okay, so kind of get an idea. Some of the problems I'm gonna say a problem is a bridge we're trying to connect now. So a lot of those calls are actually being sent to the sheriff department. So trying to get the sheriff department to reconnect some of those over to our agency is part of the gap. And the reason why I say that, because again, by me being a city employee, so if a person is calling the sheriff department, they're from China Grove area, or if they're calling from Landis area, or if they're calling from like the Faith area, many times I do not get those phone calls at all. So that's why I say it's a big gap right there, because at the same time it's not my area of as far as my jurisdiction. But what I do is try to do is if I have got information from somebody, I will try to reach out to them. And some of them might have a phone call, might have a cell phone, and some of them do contact with some of the agencies. So if they have reached out to the police department, hearsay, and it's somebody within the city limits, and they say that I do believe someone is sleeping in this property area, or if I do believe someone is sleeping in this area right here, that right there is like a direct contact me, whereas now I have an address I can go to, and I have been going out to the different departments or different agencies or the different areas where people are sleeping at, along with Rowan Health Ministry, because that's a part of our outreach. And when we get there, we're communicating with that homeless person, or possibly some of them might even be that homeless family, and we're now trying to reconnect them or get them connected to the shelter. The problem is, again, like you said, a lot of them don't want to go to the shelter after they realize either there's going to be drug testing involved, or you can't come in with alcohol or anything like that. So therefore, that's where it eliminates them to say, I don't want to go there because I don't want to get off drugs, or I don't want to get off alcohol and stuff like that. So it's almost like they eliminate themselves, but that doesn't stop us from trying to find services for them. So continuously, a lot of times we continuously either going to their campsite, trying to make sure we continuously just stay acclimated with them, making for one, doing a wellness check, making sure they're okay. That's one thing. The biggest thing we want to do is because if somebody picked up from one campsite and they're no longer there, and this is not one of us or code enforcement removed them from there, it becomes a concern because now we're wondering what happened to them, where did they go at and everything. So therefore, that's why the continuous outreach is for, is not more so just trying to get them into the shelter, is also continuation of making sure we find some way of providing that wellness check for them. And then it also gives a way of being able to soften them up, or like showing that we actually can be here for them. So therefore, that's again a part of my grant, able to buy a meal for them. Because sometimes they might not want to just go to the shelter to get a meal, so they be like, that's too far over, or I can buy them something to eat. So part of it is the police department is doing is more so making sure we have somebody on the boots on the ground, just making sure we just been able to engage with them in general, but also find those wellness checks to touch base, because we do get a lot of calls for wellness checks that say either their child is missing, and a lot of times when they say their child is missing, they're not talking about a teenager, they're still referring to like a late 20s or early 30s person. So again, I had to learn when they say my child is missing, identify who they actually referring to. But again, they still was asking us to just do some type of wellness check. So again, a lot of the problems, you say, what is it, the initial act of being done? One is trying to find a way, is it true that that person is staying in that location? Is it more than one person? And I'm gonna be honestly, if it's a family of a female with 2 kids, I hate to be ugly, then you have a single male that's identified in a homeless area, I'm gonna be honest, my first initiative is to help that single mom with kids. And the reason why I said it, because now you're affecting several households. My biggest thing is trying to get the kids, because most of those are still in school, and we don't want to disrupt their activities as far as learning more than anything. So you kind of asked me that question when I got hired, am I biased to certain people being homeless? No, I'm not biased, but at the same time, it's almost like that thing where it says, who do you help first? Do you help the one that's closest to you, or the one that's furthest away from you? Or do you help the one that's really in need, and then you have like 2 kids that's on the street as opposed to an adult? My first instance is try to help those kids get, one, safety-wise, but at the same time get acclimated back into the school system, making sure their school education is not being disrupted. So a lot of times those questions have been thrown at me. Some people say that I'm not helping everyone. So therefore, I'm not helping one immediately, but it just depends on the time of need of which one is severely that's in need at that moment. Okay.
Thank you. Let's let Kyna, share her 5,
Like when's your
6,
cutoff?
Cutoff is when they get up and walk out the door. Okay, and let's hold the rest of the questions until Kyna gets done, and then we can have more discussion. And really, we stick around here until we're done talking. So take it away.
All right, thank you.
By the way, you're wearing a running outfit here.
Yes.
I thought I should tell you, she runs Rowan Helping Ministries.
Thank you for having me. I did come from the Santa run this morning, so I'm sorry I'm not dressed like a professional here. But I do want to say that Dennis has been a gift to Rowan Helping Ministries and to the city of Salisbury. Before Dennis, like code enforcement or police officers would call us, and we would go out to visit the encampments, and it wasn't consistent. And we hired a homeless to housing coordinator who helps lead our side of outreach and partners with Dennis, and together they go out with a VA case manager, folks from the VA, and different members of the community to these encampments to build trust, which is really what Dennis was talking about. Is we cannot make a homeless person not be homeless. It's a choice that they have, and the pathway to housing can be slow for some. And so at Rowan Helping Ministries, we talk about meeting people where they are and then walking with them on that journey to housing. And so Rowan Helping Ministries is not a 30, 60, 90-day shelter. We are there for someone to be sheltered as long as they are working their case plan. So we consider ourselves a program shelter, and folks who come into the shelter are expected to be working towards housing. But with Dennis, we have helped move people into rehab so that they can come into the shelter. We've transported them all over the country back to folks we know will take them in. So we've had those conversations. And then we are here really for Rowan County. So if someone is having a Rowan County homeless situation that they need help with, they can call us and we can send Diane and our case manager out to see them. We partner with the VA. We have 14 beds reserved for veterans in one program and 10 beds reserved, well, 9 beds reserved for individuals and then one veteran family. So we have transitional housing. There are about 100 beds in the shelter for emergency shelter or this program shelter. And we have men's dorm, women's dorm, and 4 family rooms. We have transitional housing. We currently have 10 transitional housing units, and we are constructing another 12 housing units right now. They will be finished September of 2023. The next, yay! So that would be, I will show you the picture. It would be this building here, but you see it's right across from the transportation, the depot, the Salisbury depot. And then we have 3 permanent supportive houses. So we're housing 3 families right now who need someone to journey with them longer than a transitional housing program, which is 18 to 24 months. So we are adding 10 more permanent supportive housing units on the corner of Council and Schaefer. And so those will start phase 2 of our Miracles on the Horizon. But we are here to journey with people on their pathway to housing. That is our goal, is housing. The HUD standard for housing is, for sheltering and housing, is low barrier and housing first. So put them in a house and then, hope they stay. And we feel like it's a journey that folks who have moved into chronic homelessness will need more than just a house to be successful. And with a low barrier shelter, which Rowan County does not have a traditional low barrier shelter, we're a second chance shelter. So if someone relapses, we journey with them, we get them connected, and they can stay in the shelter. So we know that relapse comes with recovery. But we are in that journey with folks who are homeless. But it is a math problem. The HUD standard is just a math problem. If someone is homeless, we put them in a house, they're no longer homeless. We can not count them. But we have not helped them. And our middle name is Helping, and we are here to help. So that is, in a nutshell, what we do. Our Crisis Assistance Center does help pay first month's rent. We did get some special funding that we're able to move people from homelessness to housing, where they stayed case managed with us, and we were able to pay for several months' rent as they got their feet under them. In our shelter, we have the New to March program. Rowan Community Health Centers does mental health and medical services on our campus. When we finish the construction of the transitional housing units, my office and our administrative offices will move back to an office building there, and Rowan Community Health Centers will operate full-time medical and mental health services for free to our clients on our campus. We will also have a peer support living room on our campus by September of 2023. And that will be operated by SNH Youth and Adult Services. And that program, if someone is in crisis, feeling like they may relapse, having a mental health crisis, they can go to that space, and a peer support specialist would be there to journey with them. We are a community. Rowan Helping Ministries is here because of community. It was started in the faith community of Rowan County, and then moved into the older building in 1989. And it continues to be a community. So no one does this work by themselves. It takes everyone. So I think that, and I forgot, we offer day showers. So folks who are living on the street, so part of that building trust is they can come in and get a shower Monday through Friday. And our goal is for when someone is homeless is that we help maintain their dignity as much as we can, let them have clean clothes out of our clothing center, provide them food, make sure they have a shower, and working on helping them be successful. Okay, so I've got all kinds of materials. If anybody wants any, this goes into detail on our building campaign. Got some information about our organization in a quick summary. We'd love for you to come volunteer. And then we have our impact report for the fiscal year ending June 30, 2022.
Thank you very, very much. While you're thinking of any other questions for our two resource people today, Dennis, as you're going around from place to place, and you said there are a lot of homeless, I realize this is a number that will always be in flux, but are you talking about 50 people, 150 people? Some kind of rough idea. Okay, come use the mic.
So, and we have our point in time count.
Yes,
if you'll
that's it.
just
So every year, so that's what I was going to say, with leading by the Rowan Health Ministries, we do a point in time count. And primarily what the point in time count is one, to identify those where they slept at. Those are homeless. Some of those slept in the shelter. And also identify those who are out there still in the streets. I know last year, I think roughly we identified 87 still in the street. Something like that. I can't remember, don't quote me on my math, somewhere around there, but we identified 87 that was just living in the street. But that's not even counting those, how many we actually helped still get to the shelter from that, either that interaction or tell them to come there. And again, we got to understand, can't classify a number based off of how many of those housed in the shelter, because again, like Kyna said, even those who just taking a simple shower, that number is, every day we have several people going in just to take a shower, in the 20s and the 30s, and then sometimes that connection right there is a part of the outreach, because before they might not have been coming to take showers, and so therefore that's part of that bridge right there. We now got some type of interaction with them, so therefore it can't really equate the actual number of how many people that we actually touch every week. We're still working on that, but at the same time I can tell you there has been identified 87 around that number just still living out in the community, and there's a lot more because there's a lot of campsites that we haven't found yet, to be honest.
Like the one which for about 3 months was right outside this wall, underneath the trees here. We had somebody living right here. They aren't there any longer, but they were here for, well, maybe a month or two. Good questions from other folks? Pam?
Talk more about the low barrier shelters difference. I don't quite understand that.
Okay, so a low barrier shelter is a shelter where there are no questions asked. So we do a background check on folks who come in, because we have children in our shelter, so no background check. We breathalyze and we randomly drug test. But if somebody identifies as, hey, I'm coming in, I'm trying to be sober, I used 3 days ago, we're not drug testing you. We're going to get you into a program. But a low barrier shelter doesn't do that. When we visited shelters in the state in anticipation of the Robertson Standback Center shelter, we went to 5th Street Ministries in Statesville, and that we modeled a lot of what we have after them, except for their low barrier shelter. On their campus, they have a section that is no questions asked. They said if they had it to do over again, they would not put the shelter there, because if you're struggling in recovery and I can just go over here, it makes it really easy to relapse. And so the folks who are in our shelter in recovery, they appreciate the accountability that we offer. But in a low barrier setting, you do not have that. It's just a behavior thing. So someone could behave like if they're violent, but it would be low barrier. What we are offering in the winter when it's below 20 degrees is we're offering a warming station in Jeannie's kitchen, and that will be manned so that folks, it will be low barrier. They can come in and stay in that space, which would be supervised by volunteers during those really, really cold times.
Katrina.
I'm just wondering, how did low barrier shelters deal with the COVID pandemic when it was at its height, and how did Rowan Helping Ministries deal with COVID? Was there any testing done?
So we prayed a lot.
I know you did.
So we never closed, and not even for a minute. Even our pantry. The only thing we did close was the clothing center, and that was because of touch. So early on, there was no testing, and so we said, if you're in our shelter, you have to stay in our shelter. If you leave, you can't come back in unless you isolate for, was it 14 days back then? And we transformed our crisis assistance interview rooms with the help of EMS, who gave us cots, into isolation units. And we operated a 24-hour shelter in the middle of our campus with the pantry on one side and administrative offices on the other side of the building until we moved into a testing environment. So once we could test, we began testing, and we still test. We went 18 months without COVID in our shelter. So yeah, we ended up with it, and we also opened up. One of the challenges we saw with COVID was families who were living in hotels and then they couldn't work, had no way to pay for their hotels, and so Virgil Lattimore, who had been on our board, he's the president of Hood Seminary. I called him and we worked something out where and they were closed because of COVID. We rented, I think it was 18 rooms to put families in during COVID, and we did that for a year and a half until they opened school back up. And then that's when we got the funding and we helped move them into housing, and we're able to pay for their housing for a while longer. But we do not require vaccinations. We have our own COVID tests now. All of our staff was required to get a COVID vaccination because we have a contract with the government, and that was required. I don't know if I've answered all those questions, but when we did get COVID, we kept one of our permanent supportive houses. This is a miracle story. I'm going to digress a little bit. But our permanent supportive housing, we had a family in. And when she came to our shelter, she had 4 children and 1 child had a disability. And we got her in a program with Operation Hope out of First Horizon Bank. And she could not save $7 that first month. 18 months later, she bought a house. So that was amazing. But that was April of 2020, and we did not put anyone in that house again until earlier this year. And we used that with EMS. If they had somebody that they needed to isolate who was like in the hospital, had gone to the hospital, somebody not in our shelter, they could stay there if they had COVID. We used it as overflow. And so anytime we've had COVID, we tracked beds. We did have to reduce our capacity, which ended up putting more people on the street. So we went from an average of 95 to 100 down to about 60. And so that impacted impacted, and it's probably why they're like, we need Dennis. That was a response to COVID. And we are still masking in the shelter. It's still a CDC requirement that we mask in the shelter. And we are hoping that that ends soon, because we have spent 3 years almost going, pull your mask up, pull your mask up. So, did that answer the question, Katrina?
Yes, it did. Thank you.
Thank you.
Gene Dixon, Gene's from Kannapolis on City Council in Kannapolis.
My question is for Dennis.
Yes, ma'am.
So, Dennis, we're in the process in Kannapolis of addressing homelessness and homeless initiative. And so I wondered if you are available to come and address the city council or just a group of members in the community to talk about your program and your role.
I don't mind at all. I'm a protocol person, so I will notify my supervisor and then make sure I get chain of command approval first, since I will be acting as an agent for the city. So I definitely, but I believe Chief Stokes had talked with the chief of police down in Kannapolis, and they have, that's why I was able to get permission to go down there at one time to kind of like see what's, kind of like do like a survey in certain areas, especially like the train depot area. So I do know that was on the table, but I will reach out through the chain of command and get approval to come talk to the city council there.
Dee Dee?
I have relative to mental health. What are you doing with folks with mental health issues, and how do you differentiate between mental health, homelessness, drugs, etc., etc.? Either one of you.
I can start. So I am not a physician. I am not a doctor. So what I do is we actually just kind of like give them a referral to kind of like start the process. Of then when we get them to the shelter, some of the interview questions that's led to it, and they say, okay, then the person will be sent to for an evaluation, and let the physicians or the doctors handle the labeling of the prognosis and everything.
How do you distinguish?
So part of it is through communication. If it's someone's like having the jitters, or if it's someone who's eye contact placement, don't feel comfortable just being around talking to someone, it's just some of those probing questions that kind of like that we just kind of like just based off of experience, knowing what it is. If it's trying to get someone to treatment, and we'll let them to actually just, even the person might not, and it might look like they're on drugs. And then once we go through the process of the evaluation, we'll let the evaluation determine if the person is actually using drugs or if it's a mental health piece, because we allow the physicians or specialists handle that part. But it's just some of the trigger questions that we come up with, or some interactions, or a lot of times some of them just openly say it. I've been diagnosed with such and such, and then if they say it is like a helping word for us to kind of say, okay, we know exactly what part to start the process of, instead of just assuming. Because one thing we definitely don't is assume the person has mental health, or assume that the person has substance abuse, because they're both so close to trying to identify. You just can't simply say a person is on drugs or a person has mental health. So we kind of like start those questions, allow the interview process to lead it for the treatment.
So how involved is the police with you with mental health issues?
Strongly involved.
In New York, the mayor is now detailing homeless people to the hospital. So I'm just wondering how involved is the police department with mental health and homelessness? So
pretty much every time a patrol officer is called out on a homeless person, almost 95% of the time that patrol officer call me and say, hey Dennis, are you free to come over here to interview this person and talk with this person? And that right there is actually a way of making sure a situation doesn't escalate. So it's almost like trying to, I'm not an interview broker or anything like that. I'm not it's just more so just being able to talk with that person and tell them about the resources available. That also gives an officer an opportunity to take a step back, because a lot of times some people think officers just going to come there and try to arrest them, because a lot of our homeless do have warrants. So therefore, they're saying a softer approach from the officers, actually trying to find assistance to help them in any different way. So when I say at least 95% of the time, most of all the officers will call me. They come out just to simply have a conversation with, and they don't leave at all. One, for my protection, because again, I'm a civilian, but at the same time, it also shows the officers are trying to help the community in many different ways, especially our homeless population.
Anything to add?
So with the mental health piece, one of the things that Dennis and Diane do is we have, Rowan Helping Ministries is the central Rowan County coordinated assessment entry point. And so there is an assessment where they can self-report mental health, substance use. It's a long form. And then we can use that to connect them to resources. And we have them logged in a system. So if they are homeless in North Carolina somewhere else, we can look in the system and get more information about them. And Dennis, you're now signed up?
I'm officially signed.
He's officially on our roster to be able to use that software so that we can better track and identify folks. Because if someone has a mental health issue and Dennis is out there visiting with them, to be able to look it up in the system and go, I need to understand where this person's coming from when I speak to them. And that helps inform some of the conversations that the outreach team does.
Tamara?
Can you speak to any of the programs that you have about like re-entry and job training, how you're connecting people? It's great we get them on their feet, but now what? So I know that you guys have stuff. Could you speak to that?
Okay, so every person who comes into our shelter is assigned a case manager. If they're on the street, Diane Bruce is their case manager for us and Dennis. We offer a lot of educational programs in our campus. I think I told you our Rowan Cabarrus Community College, maybe I didn't tell you that. Rowan Cabarrus Community College does employability labs and computer training, helps with resume writing. We have groups that come in and do mental health services. We have art classes, because sometimes when you are creative, you start to understand yourself. And those have just, I don't know, a billion stories about how that's made a difference in people's lives. And we even have our Garden of Eden, which guests can go and participate in growing the food served in Jeannie's kitchen. So a lot of things focusing on mental health, awareness. We do have Cabarrus Rowan Community Health Centers that does classes. One Love comes and does classes for us and tries to address those things that are often causes or triggers of homelessness. And then we have folks who come and talk about housing and what do landlords expect. And so it's how much wraparound services can we provide to guests to help them be successful and feel connected and part of the community.
Good question?
Yes. My question's for Dennis. I sometimes have to work late at night, and I'm talking 1, 2 o'clock in the morning, and sometimes have to stop for gas and such in the course of my work. And I a lot of times get approached by homeless people, and they just want money. They don't want me to help them, direct them to some place. And some of them can get pretty darn belligerent, and you sometimes think they're about to get violent. What's your best advice to kind of cool the situation off before they stab you?
The crazy thing is de-escalation. That's got nothing to do with homeless. That's just in society in general. And I hate to. The biggest thing is I say is try to make somebody smile, but at the same time, your safety always comes first. So I hate to be ugly. No matter, I don't care if the person is homeless. I don't care if the person looks as normal as Mr. Joff. It's my interaction how I allow people to get into my circle. To be honest. So especially like 1 o'clock, 2 o'clock in the morning, I don't really look to see if the person is homeless or if the person, I'm just about my safety in general. But at the same time, kind of like if they do try to approach to have a conversation, not only keeping your distance, but at the same time, making sure yourself is in a safe environment, but also trying to have a pleasant conversation. More than anything, again, I say if you can have somebody make somebody laugh or just get somebody into a conversation, you basically eliminate a whole lot of diffusion right there itself. Another piece I would say is honestly, if you happen to be somewhere in the middle of the night and you're not in a lit area, try to move yourself to a lit area. If you want to stop for gas, try to stop in a gas station where it's like a Sheetz, like a 7-Eleven, different places like that, because they know, the homeless knows those areas are open, so therefore they want to stop in those areas as well. So more than anything on the safety side, I would just honestly say make sure you just keep attention of your surroundings, but at the same time, try not to bring any agitation towards your body language more than anything. So you almost have to use, is like just using that de-escalation piece of conversation-wise, humor-wise, but at the same time, even though you're talking to them, try to offer them connections back to other services. And if you don't know, you can say, hey, there's several agencies on the shore in this area you can talk to. Again, I'm gonna give you a copy of my card and everything. You say, I'm sure he might be asleep right now, it's 1 o'clock in the morning, but he's more than available to help you in the morning or something like that. So kind of like redirect them back to me, because now, not only you telling them no, but you telling them no, but there's an option that somebody could possibly help you. You know what I mean? So that's why I said in the beginning, I give a lot of people these cards. That way, it kind of like, I'd rather you throw it on me, not saying I'm a superhero or I can defend myself. It's just more of I feel comfortable talking with someone as opposed to somebody who's not feel comfortable talking with the homeless population, the homeless community. Because again, someone feel threatened by them when they're really no different than someone who's living inside their house, because you find more danger for someone who has their own car, who has their own house, as opposed to someone who's living in the streets. I find a better conversation with some people who are homeless, to be honest.
Thank you.
I've got a question. Apparently the county commission is trying to come up with some money, or perhaps has already allocated it for a detox center. And you know, the problem seems to be if you're in serious trouble with drugs, you wind up possibly being housed in the jail. And that's not a helpful place to get well, or et cetera. Can you speak to what the process is and how far away we are from getting there?
So spearheaded by United Way, Novant, Healthy Rowan, Judy Klusman from the County Commissioners, Karen Alexander, and I've sat in on some of the earlier meetings, because one of the things we're challenged with is we do not have a detox center in Rowan County. So we send people to Lexington, Statesville, Concord, Kannapolis. Well, is it Kannapolis? Concord. Okay, Concord. And Charlotte, so that they can detox. So that is one of the things that we need, but they're calling it a diversion center, largely because the goal is to divert them from jail and help them get connected to resources. So they are in the process. They just completed a sort of a community assessment to see what are the resources in our community, and then from there, they have to pick a place, raise the money. We wrote a grant. Rowan Helping Ministries and United Way went to the city council to request some home ARP funds. A portion of those would help with getting started, drawing up plans for their project, and a portion of it is for our permanent support, our Miracles on the Horizon project. And so we need that center here, the diversion center here, as soon as possible. And so we are collaborating. Again, it takes a community. But we are still pretty far off. But once it is done and built, they will outsource the provider. And so they'll do RFPs to find a provider to come in and lead that work.
In other words, it wouldn't hurt for us to go to county commission meetings every month and say, how are you coming on the detox? Oh, diversion center, yes, etc. No, see that we need to see the connection between policies, decision making, who has the power to do something, figuring out who has that power, whether they're using it or not, and what role can be played by just good, committed citizens in putting pressure on those people. That's people power in relation to the agencies or governmental spots where they can do something about it. So I'm serious. County commission meetings. Talk to Judy before and after the meetings and say, how's it coming? And she said, well, I don't know, talk to Greg. Oh, then we got to talk to Greg, who's the chairperson. oh, who's dragging their feet? Oh, talk to Craig, etc. And then you get to know these people, encourage the moving on this kind of stuff, and remember that we have people in place who are working on those kinds of things. If you don't believe me, just talk to Tamara, talk to other people in city council, talk to the other, council people in the surrounding municipalities, because we can make things better. It's better than it was 10 years ago, but it still needs improvement. So